I would like to ask your permission to use this video for educational purpose and on internet.
Yes, you have my permission.
We had a conversation about your spine, and we did a spine fusion for you. When did we do that fusion for you?
That was 11/26 of 19.
2019.
2019.
Okay, about almost 1.5 years ago.
Yes.
What were your symptoms before that, and how did the surgery improve it?
Severe low back pain that radiated all the way down my left leg and sometimes into my right leg.
Okay.
The pain has decreased significantly.
Mm-hmm. And you know the pain that 1 to 10, how bad was the pain before the surgery, that surgery on the spine? How bad was that pain?
8.
How bad was it after the surgery?
During the recovery?
No, right after the recovery.
Like now?
Yeah, no, the pain that you had before the surgery, that spine surgery, how bad is that pain now? Yeah.
Oh, 1 to 2.
1 to 2. So that pain did get better.
Yes.
When did that pain get? Did it get better?
It has taken some time. It just has gradually gotten better over time.
But that wasn't your only problem. You know, along the way we noticed that you have sacroiliac joint problem and pain. And this is the statistic. We know that if you had any kind of spine surgery and fusion especially, if you have again back problem, 43% of the time, we know it because that's what the study says, is the problem not spine anymore, it's sacroiliac joint. We did some diagnostic for the sacroiliac joint, and then he had a positive result to injections, and we fixed your sacroiliac joint. Which side did we fix?
We fixed the right side.
We fixed the right side. How did you respond to fixing the right side?
Very well.
Okay. But you know, if you remember, we talked about at that time that usually sacroiliac joint is a bilateral problem, meaning both sides. And we talked about that there is a chance that we have to go and fix the other side. Do you remember that conversation?
I do remember that.
What do you remember?
I remember early on before you fixed the right SI joint that we looked at the imaging and you showed me where the left was also an issue at that time, and you told me that more than likely I would have to have that repaired as well.
Yeah, generally we consider that at least in my patient population, it's about 50-50%. That, you know, half of the people that we have to go and fix the other side as well. And our diagnostic actually proved that the problem was both sides. Now, actually the good point here is that once we fix one side, people can use that side more, and that take the pressure off, and we don't even have to do the other side. But sometimes we actually have to go and fix the other side, and that chance is 50-50 usually. And there is as well something, the question you ask about that your pain goes back and forth, or it's on both sides, can be on both sides, even though after we fix the right side. Can you just tell me what question did you ask me about your pain being as well, having pain on the right side?
Yeah, I asked about the pain on the right side, which comes and goes, and wondering if it was unrelated to the left or if it was coming from the right side.
Yeah, and your question was as well, you know, that is it maybe even related to the bottom disc?
Yes.
Okay. Now, and these are all valid and important questions. Lots of people have this question. If it's related to the lumbar spine or not, for that we do pictures like this, like myelogram. And here I don't see any really dark side here, and I see the bone is growing where we did the surgery, massively bone growth. So it is not impossible, but it's unlikely because bone is growing here. And I don't see anything here. Is the white is the contrast, dark are the nerve, and I don't see anything directly pushing on the nerve. So it's much less likely that's a problem. Now, obviously we did the surgery for your right sacroiliac joint here. And bone, this is almost 6-month-old picture, but bone is growing very nicely. So it is, I don't see any screw loosening that would explain why the pain would be coming on the right side. But we know that that is nothing unusual about if you have a sacroiliac joint, that the pain goes from one side to another side. And you have two of the joint, they're very close to each other, and based on which side is more painful, you're going to just shift your weight on the other side, and certainly that would become painful. And the way I can explain it to many patients is that, like I myself have a problem, broken ankle on the left side, but most of the time my pain is on the right side because that is the side I prefer and use more. And that's sort of a natural process. And obviously when the right side become more painful, I stop using it, I give it a rest, and it get better. And I think in your case we are dealing with something very similar.
Yes, very similar.
Yeah. Now, I told you that, I have a bad news for both of us, that we are not getting younger.
Yes.
That, that is a natural process for us to get older, have wear and tear in our joint. And looking at that, certainly, we see some osteophytes up here and so on, but you don't have any symptoms from that. As well, some bad disc here. And again, you do not have any symptoms from that. We are just going to watch it. We are not going to do anything for that. I told you something that, I truly meant that, that I'm hoping you are going to be under 20 years someday, and we will fix all this spine for you, because that is just the point. If you get that old, all these discs are going to, expire. They have passed the expiry date. I think something that I can say that we did, we made the big surgery, such a small surgery, that we made a open spine surgery that was at par with heart surgery, to a small enough of a surgery that is like going to a dentist. So you will never stop going to dentist, meaning that, even until the end of your days, you are going to just make sure that you have a good apparatus to eat. And my hope is that, even with technology advancing enough, we make fixing a spine problem as the big surgery, small surgery that is going to be nothing more than maintenance for your spine, many times without this surgery, but sometimes with a minimal invasive surgery, so that we can keep you independent and keep you going. And that is the goal of our part of the spine surgery. Not to stop the time, not to stop the aging process, but make it that fixing less invasive and more tolerable and faster recovery, so people can you look at it more like a maintenance thing than a big horrible surgery that it used to be.
Sure.
Now, unfortunately, some people have as well, hobbies that you can do only in your 20s and 30s. What are your hobbies? What is your hobby? What do you like to do for relaxation?
Oh, I love to snowmobile and ATV and ride
Yeah,
motorcycles and ski and
yeah. No, and that is a part as well, I think is very important for people to understand. I had a patient that, her life was all about running marathon. And she was so surprised that with 73, she couldn't do that well anymore. Now, this is my thing. If the running marathon is only thing that gives you joy, you are going to be pretty unhappy when you get to the age that, that you cannot do that. So one of my suggestions to most of my patients is diversify your hobbies.
And I have.
Good. So what hobbies do you have that doesn't require you to jump up and down?
Well, now I go camping, go fishing.
Good, here you are.
Hunting, reading.
Yeah, you see,
so I've adapted.
Good. And I think that is a very healthy lifestyle. To, when you're young, diversify, hedging your risk. Like if you put all your stocks in one thing and that goes down, you're you're at loss. But
Yes.
if you have it, diversify your interests, your hobbies, you will always find something that your body will accommodate you. It is sometimes we want to live with the body that we had in our 20s. Unfortunately, we always have to live with the body we have now, not the one that we had in our 20s. So now you asked all the right questions, but do you have any additional comment or question for me?
I would like to add that I would not have even considered having low back surgery prior to hearing about your Olaf procedure that you developed. And I'm very pleased that I had that done. It has made a very positive difference in my life.
Thank you. I appreciate that. And I feel that many of my patients as well reflect that they're scared from spine surgery for good reason, because open old-fashioned spine surgery truly is at par in like opening your heart and doing a heart surgery. That is as dangerous as that, or taking your kidneys out. Whereas the way we do the surgery, we reduce the risk to a point that is, in many cases, it is like a small procedure rather than a big surgery. With the technology, we could achieve that. Well, thank you so much for this interview. I appreciate that.
You're welcome. Thank